Hello guys, and welcome to this video to discuss about this case and then how should we treat those lesions, okay, those radiopaque lesions. Can we do just endodontic treatment and that's fine, or we do need to, remove the tooth or remove the cystic lesion even if we want to do the endo, okay? So those are questions very important. Of course, here you guys are seeing that the teeth are fractured, okay? And well, it would be hard to rehabilitate those teeth, but you could, depending on the age of the patient, on economic questions as well. You might want to try to be conservative, and then you could try to do the endo, post, crown, and depending on the situation. But of course, the prognosis here is not favorable, okay, for those two teeth. All right. Let's analyze the most important thing here, which is to assess the probability of this to be a cystic lesion, okay? Because radicular cyst, if you just treat the root canal and don't remove the cyst can continue to grow, okay? So that's the main key point of this video of today, okay? The cystic lesion needs to be removed, okay? There are some cases that with the endodontic file you are going to provoke a rupture in the epithelium of the cyst, and then the cyst stops growing and it might even recede. But usually if the cystic lesion stays there and you treat the endo, then the cystic lesion can continue to grow, okay? Even if you do the extraction and the cystic lesion is there, the cystic lesion can continue to grow and now you have a residual cyst, okay? So don't forget about this. After the extraction, you need to either enucleate the cyst or else you need to cure it to make sure you remove everything. But here we have two radiolucent or else hypodense lesions, because that's 3D. We are seeing here a CBCT, of course, and those two lesions, they are well limited, they are homogeneous, they are radiolucent or hypodense, of course, and then they are periapical lesions, but they have the insertion even at the middle third of the root, okay, here for example, right? So the middle third of the root and even on the other side. So those lesions, they could be radicular cysts, but then that's just part of the differential diagnosis, as they could also be periapical granulomas, okay? So they could be both of them. It's a little bit too big actually for a granuloma regarding the insertion, especially here, but this could also be periapical granulomas, okay? Now, if we assess that's not sagittal, that's a cross-sectional image because it's oblique now, we are seeing that, it's almost even an endoperial lesion because the periapical lesion is actually almost in continuation with the bone loss here, with the buccal bone defect, okay? So we need to analyze this property. We have buccal plate resorption. Take a look at this here in the axial plane. Lingual plate, it's still, well, there is resorption as well, but take a look at this, at the extension in the axial plane, right? Even with a little bit of buccal plate expansion, maybe a little bit only, but they could be cysts as well. So if they could be cysts, then of course, if you're going to do the extraction, you do the extraction, you remove the cysts, you enucleate, or at least you curate everything. Then even irrigation with saline solution, that's one of the approaches described by the literature. And then you could even do a grafting procedure. Well, at the same time that you remove the cyst in the same procedure, yes, that's actually no contraindication. There are several articles showing this, okay? So irrigation with saline solution and then socket preservation procedure, okay, with any particulate bone substitute. Ideally, one material with collagen you should choose because those are sticky materials that stay in the socket for socket preservation. And then you would do sutures here, of course, and you would wait for the healing in order to place an implant in the future. Okay, so this would be required mostly for a dental implant. Okay, of course, we don't have the entire case, so even a fixed bridge could be an option. Or, of course, depending on the age of the patient, if you want to do the endo, post, and crown, but that's not, we can see the line of the soft tissues here, the line of the gingival tissue, and the fracture is actually, even below this line. The root, it doesn't have a dimension very good. Well, it's actually not the best prognosis if we want to treat the root canal here. Okay, but everything is discussable if we are, doing evidence-based dentistry. Okay. So if you guys like this analysis, please, if you disagree or if you agree, give your comments. Don't forget to subscribe, because we have videos, analysis of cases every week here, and more than once a week, because now we have our short videos. So make sure you follow up everything. That's your regular dental training from the comfort of your sofa, from the comfort of your home. Okay? See you guys in the next videos.